afternoon, everyone. If I were healthcare czar with the aspirational goal of increasing patient engagement across the whole breadth of the U.S. healthcare system, I might devote, say, 70% of my whatever resources and time and focus them on those areas that research shows have the greatest impact on health status. Let's say nutrition, diet, weight management first, and then exercise second, and thirdly, abstention from smoking and other substances and so forth. And then I might take 20% of my resources and devote them to some of the areas that we've heard so much about yesterday and today, helping to smooth out and create more meaningful interactions between providers and patients. Navigational services and connectivity programs, patient-to-physician partnerships, and so forth. And then with the remaining, let's say, hypothetical 5% of my resources, I might just drop down into the dismal swamp of medical billing and spend just a little bit of time there hoping that the problems would get solved upstream. Well, at least it occurs to me that that is an aspirational way to think about how to catalyze patient engagement across our healthcare system. That, however, is not the approach we used at MedDirect. And I'd like to tell you in just 3 or 4 minutes what MedDirect has done. But if there's an aspirational way of thinking about patient engagement, we took a realpolitik, a realistic, very business-like approach to this challenge of patient engagement in the context of patient billing. Now, why did we start or pick patient billing? A couple of reasons. One is we followed quite a bit of research, consumer research, that indicated that of all the points of pain that healthcare consumers have, across their lifetime of experiences, the number one area, can anybody guess what it might be? Their bills. And I had that experience as a CEO of several hospitals. Medical bills are the very last impression that every patient has, and it sticks in your skin, and to me it's just the epitome of the flaws in our system. Nothing is more broken. The second thing we noticed was studies that showed that there would be an enormous growth in patient responsibility payments. We saw a slide yesterday that showed as much potentially as a third of personal health care expenditures in the U.S. healthcare economy may in fact be consumed by what's called patient responsibility bills, or out-of-pocket bills is the term CMS uses. But it's the bill either after insurance has paid everything they will pay, or it is the amount that's left over, or that an individual owes if he or she has no insurance. So we looked at that as an enormous opportunity and an enormous problem to solve. Let me describe briefly MedDirect. First of all, it's a patient communications and patient engagement company that started in the area of medical billing. We handle approximately 300,000 patients and their accounts every month. About 3.7 million patient interactions over a year. We manage about 7.5 million patient accounts. So we're not huge, but we're growing very rapidly, and we're beginning to get some scale. We began in the medical billing space, but let me quickly note that we are not a collection agency. We don't handle delinquent accounts. If a patient cannot pay or is unwilling to pay, that's the end of the interaction. Our conversations end amicably with the patient, and we recognize that there's a portion of the population that either will not or cannot afford their medical bills. So we do not pursue delinquent accounts. From the very beginning, we had the notion that we wanted to build a company that would generate patient trust. First item of business, it was to build patient trust through communication and education, to empower consumers by giving them that education to be able to understand what otherwise is a very, very unpleasant, very last step in the medical care delivery process. We believed that nothing is more important than than communication, and we set as one of our models the Nordstrom's level of service. As some of you, maybe all of you know, Nordstrom's in the retail clothing space. We aimed to become, and we still do today, to become the Nordstrom's of patient communications. And from the start, we looked at the business platform that we created as something that we hoped we'd be able to use for the patient bill at the far end, but we hope to be able to move, if you will, upstream from that point into medical service delivery and possibly even further upstream to add on additional communication opportunities for us. MedDirect is usually employed by a physician organization or in some cases hospitals. We operate on a white label basis, and the recipient of our service is the individual patient. The performance bar I need to recognize for improvements in medical billing is very, very low. But with that low performance bar, MedDirect has had enormous success. We typically, invariably, increase physicians' organizations' receipts from their patients by a minimum of 30%. We very frequently double or triple that. We invariably find 15% of the accounts that are sent to us as no insurance. We find incremental sources of insurance. In some specialties, that's as high as 30 or 40%. We do that because we talk with, or we try to talk with, every single patient who has not paid his or her bill in 30 days. And so we've been successful with our customers. We have very high levels of patient satisfaction, and we are expected to double in size over the next 12 months. We were purchased 18 months ago by a medical billing and coding company called MedData, which enabled us to strengthen even more our technologies. And at that point, we had a successful exit, but the company continues to operate as the patient platform arm, the patient engagement arm, rather, of MedData. So it's been a wonderful partnership. Let me mention now just two elements of MedDirect's functioning, not as an advertisement for MedDirect, but because they repeat, these two items repeat themes that Will Hugh mentioned yesterday in his introductory comment, and I think they're so important to any successful patient engagement company. First is technology, and the second is the importance of culture. In technology, let me just mention what our technology enables us to do. First of all, it's been mentioned many, many times, accessibility. We have a patient portal that provides total and complete accessibility of patients to their data in our system. We produce patient surveys, and we can produce surveys in real time within 24 hours of a patient being seen in a medical delivery office. We, in fact, can survey that patient to ascertain on behalf of the provider their levels of satisfaction. We can do appointment scheduling, making appointments, confirming appointments, doing follow-up reminders. We can deliver public health and screening and preventive health announcements on behalf of our clients. We're available for registration and scripts and the ability to merge disparate systems at the point of service for a patient. We have the capability of merging bills and IT systems across multiple platforms, Epic or Allscripts or GE Centricity or Cerner or McKesson. So the patient may be seen by a half dozen different practitioners for a given condition, may have a pathologist bill, may have a radiology bill, may have a surgeon involved, and there probably was a primary care physician. We can merge all of those bills and present that information and explain it intelligently to a patient and answer his or her questions as to why am I getting a bill from a CRNA? What is that? We are able to communicate with our patients in a multi-modality way. We built our platform such that we can communicate by text, we communicate by email, communicate by fax, by phone, by paper. We use predictive analytics, and we are completely full-time and are able to link the patient, our patient representative, the the insurance company if necessary to resolve matters that pertain to third-party billing in addition to the out-of-pocket bills. And so we're able to link all of that process and serve as a sort of a navigator for the patient dealing with these questions of ability to pay and paying their actual bill. So if you will, our technology is sort of the beginnings of a CRM, a client management resource system. It's not a complete one, but we're inching towards that little by little. So insofar as concerns technology, we've learned that we can only be as good in engaging patients as our technology and our business processes enable us to be. The other critical ingredient I'd like to note is culture. And let me just say that you all know culture is a combination of many, many factors. It's the vision of the founders and the business processes and the values and what you reward and what you penalize and the leadership and so forth. But our culture is an important one to us, and we designed it to the maximal extent around individual patient needs. So what does that mean? Our hours of service, we structure them according to when we see we can reach patients by phone. Our staffing levels are highest when the most patients are available. We are multilingual, and we'll be adding, in 2 languages, we'll be adding a 3rd and a 4th, I suspect, in the not too distant future. We tailor our modes of communication as well as the times of communication based on what our smart data systems informs us works with a given patient. If the patient communicates with us by text or responds to a text message or an email message, we in turn respond. If the telephone call is answered at 10 o'clock on a Wednesday night, the next call that we have to make is at 10 o'clock on Wednesday night. Our scripts as well are modeled based on simplicity and clarity of the English language, which is unique in the medical billing world. Lastly, on culture, let me just note service, service, service. That is where our culture begins and ends. We recruit for patients, or for staff rather, based on their ability and their willingness to solve problems for patients. We train our staff. We monitor and have QA programs that focus on that. We reward, we penalize on that basis. We reinforce over and over and over again. One of the critical lessons we've learned about culture is that a patient engagement business requires 100% devoted retail culture. It's not a byproduct. It cannot be a byproduct of staff people who are doing lots of other things and then they take a patient telephone call or interact with a patient. It's not a collections culture. To use a financial term, it's not an early out culture. It's got to be a culture that just plain revels in the joy of solving problems for individuals. So in a nutshell, that's our story. And we've learned that even in the dismal swamps of medical billing, the most complex, the most bureaucratic and inhumane, I think, corner of healthcare delivery, it is possible to construct genuine service for patients that engages them to make better decisions and hopefully to be better patients. We are running a few minutes late, so I am going to end there, but I'll be pleased to answer any questions afterward, and I thank you very much for your attention.